Well, I think in my facility that if they can improve on the staffing level, um, because that I think would help with infection control. Because
Mhm.
when you have two CNAs covering 60 residents, it's very difficult to be as tight with infection control as they should be because they're
Two
running back and
CNAs
forth.
for 60
60
residents.
residents, yes.
Wow.
And that's usually every shift.
Mhm.
And I think that if they increase their wages, that would help as well.
Okay. So if they're able to take care of
And
the basics, then they could start to address things that would maybe help your quality of life.
correct.
Am I hearing that right?
It's almost the staffing is worse than the pandemic itself
Mm-hmm. Mm-hmm.
because
Staffing,
it's
that's
very
huge.
straining on the staff, on the
Yep,
CNAs, which trickles down to us,
sure.
obviously.
Yeah.
We have been very short staffed this entire year. People are leaving in every department. We're down to, I would say, between a quarter to half staff of what we used to have.
Wow.
During the third shift, we've got a nurse who's taking care of at least 35 patients between where I am and a floor above me.
Wow.
Um,
About, but we have 20 residents to an aide, and if you are needing more assistance than one person, it means long wait times. So that increase in staffing would be great.
Only have two girls on aides, and sometimes they're on split shift, but they have to go upstairs. And there's 22 people on a floor, so it sometimes makes it bad.
The ratio per resident, there are many days where I have 10 minutes or less per day with an aide. And, it's usually about 10 minutes per day per nurse. I'm sorry, per day with the nurse. And
I would actually like to see a federal mandated laws that protect our nursing homes that would say that there can only be so many residents per nurse, so many residents per CNA. I believe that the prison population has stricter rules than nursing homes. So I think that's something that's badly needed, that our nursing staff, in case of an emergency, if there's a full code and there's not enough nurses, you have to worry that your family member is not going to get seen or get taken care of. So I really do believe that we need to do something about that legislatively.